Jersey out west up to 35 corridor. If you've noticed some purple flags, it is Overdose Awareness Month day. I think the day is actually the 31st on Sunday, and that's fairly new, the awareness, like within the last couple of years. But it's a topic overall discussion about substance abuse, and not only substance abuse, but the overprescription of pain pills and the unnecessary. So it's unfortunate. It happened before, but more so now, and it could have been prevented in my experience.
Because you worked in
I worked in 2005. I started supervising the detox at Bailey Seton. So detox is acute detox. So as you know, what people don't know, it's medically assisted because of the physical symptoms of withdrawal. When you stop using opiates, you're very uncomfortable, and it drives you to use more. I don't think that you're at risk of death like alcohol, like severe alcohol abuse withdrawal can lead to seizures and death, but it needs to be medically assisted to manage the symptoms of. And ironically, a lot of it resembles a lot of things like menopause, like hot flashes, anxiety, palpitations, things like that. But what I saw in 2005 was we had two wings. It was heroin and alcohol. You had your junkies and your booze hounds. And by 2007, what happened is both places merged into one because everybody started using pills, and it was no longer this sort of like your fault kind of situation, or you failed at life. So
you were there at the ground floor of like when this took hold.
If somebody would have said to me, I think everywhere was like ground zero for the opiate crisis. So New Hampshire, Staten Island, in Staten Island they were selling them off the back of ice cream trucks, the pills and stuff. And the funny thing is like, yes, it impacted our life expectancy. Yes, it led to a lot of deaths. It's significant to raise awareness and create a purple flag for something. But I think what people don't realize that a lot of this got out of control with collateral prescriptions. In other words, you know, your aunt and your cousin and your mother gave you one because they were in the medicine cabinet, and that's how it led to
the run over. Like,
it wasn't like a shady. You know, most people don't. Here's a full disclosure about substance abuse. Nobody wakes up one day and decides to be a drug addict, right? There's a lot of history involved. A lot of it is like adverse childhood experiences, negative, lifestyle things that happen to people that kind of self-medicate. That is a big piece of it. When you interview, say, like 1% of the people, I just started at a party. That was like unheard of. And usually it's like post-surgery. After you had a surgery and you're still in pain, you can't keep taking pills, something went wrong. But people started, most, let's just say innocent people had been prescribed after a surgery that may or may not have been necessary. But the end game is by 2018, when I was doing the doctor work, there was this sort of like mandate by Joint Commissions to make sure that you had non-pharmaceutical pain intervention. That was the first time it was being said. American College of Physicians was saying acupuncture is the first line treatment for acupuncture. Unheard of, after a long period of time. But we knew it in school. We knew it as the NADA protocol and the points in the ear. I don't know if it was a big thing when you were at Eastern School, were people talking about it? Was it an issue?
Yeah, NADA was talked about. We knew about its addiction roots, but then by that time it's been expanded to other things, like for other things. But we do know about that origin of it. Tell me though, in terms of like what other, before acupuncture got put on the table, what other things were people doing besides the IOPs, the group therapies? Like, is there anything like physical that people were doing aside from like methadone or things of that nature?
No. You have your methadone clinics, obviously, but the standard is detox, rehab, which is a 28-day stay,
And those things are like
and then
mills,
outpatient.
right?
What?
A lot of those are like mills, right? Like you go to Florida, you get like...
So yeah, there's the Florida Shuffle where people, like other places would shop for people who left. Like say you would go, you didn't like the place, you can keep you in, but they can't keep you out. Well, they can keep people out, but they don't keep the patients in. The patient can walk out any minute, and that was a common thing. You sit there, we sit with the counselors, and just boom, like walk right out. But what we saw, I think, the NADA protocol came when there was a crack epidemic. And crack is crack, and honestly, there's no detox for crack. You have to be, you have to have had some sort of alcohol or some opiate abuse because it's cocaine, and there's no acute detox or medically assisted reason for cocaine. But what I had done when I was treating is I felt like the treatment was a little outdated, and I switched it to reflect more, Shenman sympathetic, liver, lungs, and heart. I think the anxiety is really, the ear acupuncture is really good at managing the anxiety, so when you're withdrawing and you're uncomfortable, you can kind of turn the volume down on your discomfort.
So if I'm understanding correctly, you innovated the old protocol because you felt it was like outdated and ineffective. So then you transition to your own personal protocol, which manages the anxiety, which you feel is better for keeping people clean longer term.
Well, the irony of it all is that in detox, you're only managing symptoms. The worst part is, like, you treat a patient, they respond well, they had been there before, there's a lot of recidivism and people coming back over and over again who liked and had acupuncture, but once they leave detox and I'm not there, somebody's not there, their rehab either didn't have it, or they came back and settled in and there was we were trying to put it into outpatient, that didn't really work out, but people kind of lose sight. But even still, like, if you really think about, like, how unnecessary the purple flags are. I mean, yes, you should be aware that people did lose their lives, but it could have been avoided, right? You could have done acupuncture before you tried surgery. You could have done things to manage these symptoms before you tried something pharmaceutical. And the irony is that you're only managing symptoms, right? You're not helping people. So I think the conversation needs to switch to relapse prevention.
I was about to ask you.
Yeah.
So let's take a time machine back to when you started, like before it blew into what it is now. How would you have seen things directed differently so we don't have all these purple flags and all these, like, what do you think is like the number one thing that they miss, that we didn't know then, that was mismanaged, that could have been done to prevent us being where we are?
So I think, first of all, if you could have just, again, we know about trying non-pharmaceutical, minimally invasive procedures to avoid surgery, and now even surgeons and doctors are limiting their supply of the, and let's just face it, the Sackler family had an agenda. Like, they wanted return customers, they gave out highly addictive substances. You hear the terms, you hear hillbilly heroin, you hear all these things. It was like, from the top down, it was just like, get this out to people, get them on it, and then, avoid the lawsuits, but it did cause a lot of harm. I'm just saying, in a situation where you had a surgery, maybe you didn't try the surgery, you didn't get the surgery done, you would have avoided that. But avoiding things like, you go into detox and then you lose the patient. You go to a very expensive rehab. I mean, people spending $80,000, $90,000 on their child sobriety is insane. To go to Cliffside, Malibu to talk to a horse, that's not really learning or coping. What I think the best thing would have been for anybody, and there's a lot of evidence to show, it's like therapy with acupuncture, right? Use the acupuncture to manage physical symptoms, and then do the work to kind of work yourself out. But even just within the system is like, the system is broken, or it's not working properly, or the care isn't there, or right or correct.
So you feel that acupuncture should slip in as to keep patients compliant on their recovery plan?
Yes.
So
because when you're fighting an addiction, that's what's eating up all the resources. What you're fighting is like that sort of like euphoric feeling from the medication, and then when you're not on it, you're uncomfortable. So one of the things I used to say is, I know acupuncture works because the collateral effect, like the patients, the staff working were always telling me, can you do something with these people? Because they're all wild, riled up, they're all uncomfortable. And yes, we did a lot with those people, but the unfortunate thing is, like, we lose the people when they go out and they go to different rehabs or different halfway homes, and there's no continuation of care. If you want to be successful and be there, and we've had some people who've been really good and have done really well because we've been able to monitor them, and their therapist been able to monitor them, and they've been able to kind of re-assimilate and do the psycho-re-educational training, because it's a lot of work. It's not an easy thing.
Not to get us too off the path, but there's a lot of people out there who have family members who have addiction. They probably might not understand, like, how can sticking needles in my family member who's suffering from this help? Can you describe, like, a moment, particular story that comes out into your memory of, like, when you start to see that shift, like when you first started, and when the staff, like, started to see, oh, this is actually working, for, like, maybe there was a particular hard case or something like that. Like, when was the moment that, like, you saw that, like, oh, this was making a change, and, like, when I do this, they're getting better results than when they don't do this?
Yeah, I mean, I feel like acupuncture is definitely a piece of the puzzle, but it's hard to kind of get it in or available to the like the train stops, right? Like acute detox, rehab, maybe not, outpatient, definitely not. So you lose the patient if that patient or a family member, there's somebody who's in treatment or trying to stay clean or trying to sober up. I would recommend for them to definitely give us a call, because we get the call sometimes. I've been doing this for a long time, and one of our most popular videos is the one we did on addiction, and people call me, it's like, do you do anything? And I said, I can't do anything. You have to be medically assisted first, and then we can work on it. What we've had success with is the overuse of the dependency on Xanax. Like getting people off of Xanax with herbs and acupuncture is a thing. We do it over and over again. We get them off the medication, even like their antidepressants or their psych drugs, and it's effective. But, it's foolish to think that it's just the acupuncture alone. Working with a good therapist, doing the hard work, and acknowledging and containing the stress of the withdrawal when you're not taking the substance, and then your body has to kind of manage the stress response. It goes like overboard, and that's where people feel uncomfortable. Hypersympathesis, that's what we'll call it. Revved up state, fighting the bear. And then they'll tell people, oh, meditate, do this, do yoga. You can't do that. And when you're revved up and you're like going crazy, like you're not uncomfortable, you're very uncomfortable, not feeling well, you're not gonna sit in a dark room, you're gonna go nuts. So things like physical anchors, like yoga or working out, along with a good therapist, and acupuncture could be part of it.
So it sounds like this is like a good low lift way to get them in that state. Nothing that they have to be in, like the agent, right? I don't have to sit and meditate. I don't have to do this. I can just.
Well, you have to be able to get to that place, right?
Exactly.
And if you're all revved up all the time, and you're fighting this sort of like the cravings.
Yeah.
Right? When you don't, so you're on a substance that's suppressing the production of cortisol, the stress hormone, okay? And then you get off of it, it's like pulling the rug out. Now your body's been overproducing cortisol, and you're in like fighting a bear mode all the time, and it just wreaks havoc on your system. So you implement the acupuncture, and the patient feels better, but then after like a week stint of detox, they're gone. Like you maybe get to see them once or twice, they like it, and again, they go to a place, they have it, maybe they don't, but then if the place doesn't emphasize that acupuncture can be part of it, and it's kind of seen as like a foo-foo sort of like.
I got you.
But if we talk about the mechanism, if you can regulate that cortisol release that creates the stress, whether you're trying to get off or quit smoking the cold turkey, or trying to kick the habit of some sort of substance, that overproduction of cortisol when you're not getting the substance that's pacifying is that sort of like, chasing your tail round and round in circles kind of situation. And when acupuncture can do that for you, you still need to have someone in place who's kind of going to walk you through, like, what do you do when you drive by the quick check? Do you lose your phone that had the contacts of all the, people lose their phones, they get rid of their phones because their dealer was in that phone. Or here's another thing, this is how complicated it's gotten. When a real estate agent would set up a house, there was a protocol to eliminate all the pharmaceuticals because people would shop open houses to get the drugs. That's a problem. The other problem is the use of fentanyl. A lot of dealers would cut and put fentanyl into the dose to create an overdose in order to get the people that were kind of like this community, addict community, they all use together. So if we lost Johnny to an overdose because of fentanyl, then Sue will start using again from the sorrow and the sadness, or the derailment of that was like a systematic plan to get people to use again and sell, because
right, you take one out, but then you get the five.
Exactly, because after a while the pills got expensive, you still have to support your habit, and that's what led to heroin, that's what led to fentanyl, and it's gotten bigger and more complicated. I mean, listen, our life expectancy went down in the United States because of overdose. Like overdose was surpassing car accidents and whatnot. And then you have the introduction of COVID, and then you're going from 88 to 87, just like within a couple of years. So it's a problem.
And that's your frustration, right? Because because it's like just a small barrier to just not let these people just go out into the wind. If there was some kind of intervention for them to get acupuncture, to get their mind stable enough to get the therapy recommendations. And then if you get triggered, you can come to us.
Yeah.
But then as you're working to put your life back on track, you can have more meaningful therapeutic outcomes because the acupuncture puts you in a place that when you go to your therapy, when you go to your IOP, you can listen because you're not thinking like,
Well,
oh,
yes,
shut up.
you can
because
do
I
it
wanna-"
before if it's gonna be a rough session, or you
Yeah.
can do it after when it is a
Yeah.
rough session, so
Yeah.
that you kind of manage. It's a great way to manage the physical symptoms. You still have to do the mental work.
Which is something that I'm just gonna plug it here, which I don't think we get enough credit for, because acupuncture can like slip into so like enhance, right? Like
Yeah.
Antoine put up the thing for like fertility, right? Like up to like what 500, 1,000% more effective. It's like the same thing. It's like we can be used before the treatment session. We can be using the acute detox. We can be used like I feel triggered. I think I might call my dealer.
Mhm.
Call your acupuncturist instead. Get settled down and then make a plan. Like
Yeah.
you can see how so many different ways for us to fit in. It just seems like you said, it's for somebody who was there in the beginning.
The process is the problem,
Yeah.
right? Like you go out of detox into rehab, and then you already know that you're gonna fail in rehab, right? Because there's other rehabs looking to pick you up,
Yeah.
right? Because they're not concerned about your improvement, they're concerned about billing the insurance and making money if they can, right? Because it's a business, right? And that's not a great way to do it. And then outpatient, it's like now nobody's really monitoring you 24/7. So you could do anything, or you just kind of escalate. One of the things I had seen, surprisingly, Florida mandates acupuncture in drug court.
Mhm.
Good luck trying to get that done here. But I think it could be a thing. But there's ways to do it. There's ways to do things better. If you were to ask me, I would say get some mental health help first.
Yeah.
Get a good therapist. And we have actually a lot of referrals, because I've worked with these people at detox, and then get like with us.
I was about to say, like, let's say there's somebody here who likes what you're saying, who wants to know what to do. Like, what are like the 3-4 steps? It's like step one, get a therapist. Do we have like?
Well, it depends on where you are. If you're trying to kick the habit, obviously you have to go to detox first,
Yeah.
right? Before you go into detox, you should have a plan of like what you can. Are you going to go to rehab? A lot of insurance companies aren't picking up rehab anymore. It's like right to outpatient. They're going to an outpatient program, which is fine. But it's like getting to, the other thing too is like with addiction, there's a lot of shame. Like you feel like you've left your parents down, your support system down. I don't think that's good. I think what you need to be is realistic and know that this is gonna be probably like a lifelong process, and buckle down and commit. And I think the big piece of that is the therapist, like getting to that person who's gonna help you one-on-one, do the right kind of work so that you stay clean and sober. And then, obviously you can reach out to us, we can help you. Alcoholics Anonymous and Narcotics Anonymous isn't for everybody, right? Maybe that's not the way. Maybe rehearing other people's problems is triggering, right? That's the thing that we hear. I heard in this person, it's the other thing that I heard that kind of upset me a little bit is like people were calling themselves addicts, like labeling themselves with a disease that they couldn't really, like it was almost like an excuse of why they were using. I'm an addict, so therefore I use drugs. So there wasn't like this, the vocabulary had changed. It's like, yes, it's a disease, we get it. It's no longer this sort of like economic
It's not
dropout,
Yeah. It's not
right? It's not like you
social
failed in the
Yeah.
economy. Because part of it, it's the one thing I also learned in detox way back is it's environmental and inherited. Like you're seeing other addicts bringing their children into detox, right? You're hearing stories. I used to dodge my mom's needles in the shower.
Yeah.
I used to see my mom on the couch taking pills.
Well,
Like this is what I'm saying. Nobody wakes up. It's like a long story which you have to unpack with the therapist. And then again, we're here for the physical symptoms, which helps you stay compliant, helps you stay clean.
Which, just for anybody listening, it's like, as you know, like addiction is classified as like a family disease, right? So just because you're not the one with the addiction problem doesn't mean that you don't need some kind of treatment or therapy, right? They're always saying that, the support system needs to be good. It affects this, like, little Johnny might be the addict, but the mother is the one suffering, getting symptoms as well, because she doesn't want little Johnny to become an addict. And as we know that, like, that's cortisol, that's causing all the issues. So acupuncture helps the family, not just the people.
Yeah, I mean, that's, of course, yes, we can treat the whole family who are dealing with the process. It is stressful, we get it. But focusing on the problem, yes, it's a disease, yes, it's not a misfortune of life, but like I said, watching people, hearing the stories, hearing what people are self-medicating from, there's a bigger picture than just, staying clean. It's not easy to stay clean. When you've had the greatest euphoric experience of your life, and then you're not doing that anymore, that's really what you're fighting. It's like, addiction is cigarettes and nicotine. Eating food, like if you can't have a cheeseburger or French fries or a milkshake, you know, your body's gonna wanna crave that, and it's gonna drive you crazy. So picture that like 3,000, 4,000 times. So remember, it was easy to lose weight, everybody would be skinny. Obviously, you see what that's problematic. Different situation, but when you take it and you apply it to like substance abuse, it's magnified, it's augmented, and that one person will spend their lives trying to fight that, chasing that craving. And when you don't get what you want, you produce the stress and the cortisol, and you see how it's just like this spiral of like, you know, stress and stress response and cortisol and anxiety and stuff. So if you can kind of get intervene and like turn the volume down on the discomfort with the anxiety, then maybe somebody could be compliant. Look, you know, the big institutions like Harvard will say that acupuncture with psycho-educational training is going to be far more effective than just one or the other by itself.
Right.
So these are the options. You know, I had my issues in the substance abuse field. The population isn't always compliant. They are disruptive. I had gotten into an altercation and then realized, Jerry Maguire moment, like, what am I doing here? Like, why am I here treating the symptoms of something that could have been prevented, right? With something with like acupuncture, right?
Yeah.
And I was just like, you know what, I'm done with this. Relapse prevention. And we're doing very well with helping people getting off of Xanax, because that's the next one, you know, the opiate crisis. I'm surprised. I haven't been out of the field. I don't know if there is a Xanax crisis. I'm sure there is. But yeah, here we are today. What do you do about it?
Yeah. So come in, get your cortisol regulated, so then you guys can stay on the straight and narrow path of addiction.
And then give us a call. We have great resources for people that can really help you stay clean if you're serious about it. Yeah, let's have a discussion about it. Give us your thoughts.